hormonal changes that lead to pelvic organ prolapse and pelvic floor issues. But could there be other incidents in life, like for example, childbirth or other situations that could cause, this type of damage later on? Not that it's
Yep.
not reversible, and I know you're going to speak about that, but could you tell us how it can happen?
hmm Pregnancy and childbirth are well-established risk factors, but it's important to note that this can happen to people who have never been pregnant, who have never given birth.
Mhm,
So statistically, again, 50% of women who have given birth, but again,
mhm,
this is something you don't have to have ever been pregnant before. So things like chronic constipation, that is a huge contributor to the development of prolapse. Chronic coughing, so people who may, smokers, asthma, emphysema, a lot of people will notice that if they have this, symptoms are greater if they have, some sort of a coughing illness, like, well, obviously the most recent is COVID. um,
mhm,
um, Falls, so things that have disrupted the capacity of the muscles to do their jobs, previous surgeries. There's a specific birth injury called levator avulsion, where that's not quite the right term because avulsion is literally muscle pulling away from the bone. So it's more levator tears, but levator ani is part of the pelvic floor, and about 30% of births will have a tear specific in the levator ani group of muscles that can increase the risk of pelvic organ prolapse. So those would be the most common from
mhm.
a contributing factor.